We call it America's finest city, and we know how to enjoy it. Great weather, great locations. Many of us are healthy and active, but America's finest city suffers from America's biggest problem, childhood obesity. Hard to believe, but our rates are higher than the national average. Now, we all know how to solve the childhood obesity problem. Make healthy choices to eat better and to get more exercise. And if every family had those same options, it would be easy. But when the environment doesn't support healthy eating and exercise, it can be difficult. In some cases, nearly impossible for families to make healthy choices. There are food access issues, neighborhoods that are virtual food deserts with no grocery stores and no access to affordable fresh fruits and vegetables. Families have to either travel or shop where they can, in mini marts and liquor stores where healthy options are just not available. Inexpensive fast food is a daily choice for many families. The further a family has to go to stretch that food dollar, the more likely they are to choose fast and processed foods that are less expensive, but also less nutritious. In some neighborhoods, even going outside to play is impossible for kids if the environment isn't safe or there are no sidewalks, parks, playgrounds, or bike paths. But the problem is in new neighborhoods too, planned communities that never planned for health. Where a child who lives here has a friend who lives just 200 yards that way, but they can't get there from here without getting in a car.
Walking and biking among children has declined more than 40% in the past 3 decades. Just a generation ago, most of our children walked or biked to school. Today, this is rare, due largely to unsafe routes and poor walking conditions. The health of communities is linked to the design of communities. Neighborhoods that are safe, pleasant, and accessible for walking can promote health and help reduce obesity.
Our children are paying the price for the lack of healthy choices. With an estimated 1/3 to 1/2 of children born in the year 2000 expected to develop diabetes in their lifetimes, this is the first generation in history that may have a life expectancy shorter than that of its parents.
Childhood obesity is a problem that has been festering for years. The simple truth is, far too many of our kids are out of shape today because of poor eating habits and a lack of physical activity. We must act now to ensure that there are healthy choices for all our families in San Diego County, or there will be long-term consequences, socially, physically, and financially.
My medical colleagues and I are now seeing conditions in kids that we only saw in adults, like diabetes. And it's challenging because I can't write a prescription to change the environment. These are big problems that require us to work together, and we are doing some revolutionary things in order to change this.
That something is the San Diego County Childhood Obesity Initiative, a unique public-private partnership that has engaged community partners to work together to impact childhood obesity through environmental and policy change. For the first time, leaders from government, healthcare, schools and after-school programs, early childhood providers, community-based organizations, media, and businesses are working together to assure that healthy choices are easier for families to make in their daily lives.
Obesity is frequently in the news. Stories often showcase the results of unhealthy living, but rarely do we hear stories of communities coming together to solve this problem. Well, we're here to change that. The Board of Supervisors initiated development of a county-wide action plan to address the childhood obesity epidemic in San Diego County. With this plan as a guide, the initiative has brought local leaders together to address the environmental factors that contribute to this crisis and undermine parents' efforts to protect their children's health.
The initiative's partners are working together in innovative ways to improve neighborhoods and assure that all children have healthy food options and opportunities for physical activity. Schools are making healthy changes and implementing wellness policies that offer kids nutritious foods and more physical activity during and after school, with more salad bars, healthy options, even school gardens. A growing trend, but one with plenty of room to grow.
Even with their other priorities, schools recognize they have an important role to play in children's health. Kids who are healthy and fit are more ready to learn, have fewer attendance and behavioral problems, and just do better in school. Members of the Initiative School and After School Committee offer their professional expertise in many ways. They serve on school wellness councils, promote healthier fundraising, support breakfast in the classroom programs, and communicate these types of healthy changes to parents, teachers, and the community. After-school providers also play a key role by offering healthy snacks, time for physical activity, and programs such as school gardens to teach about nutrition in a hands-on way.
And you can't start too early. The initiative is bringing together childcare and preschool providers to implement policies in these settings as well. It's important that young children have healthy choices even before they are old enough to go to school. At the San Diego County Childhood Obesity Summit, we brought together nearly 650 partners to explore new ways to work together to prevent childhood obesity. Business owners, community members, faith leaders, people who never thought about childhood obesity now realize they have a role in its prevention.
Yeah, give God praise everywhere we go and everything we do to promote health in the faith community.
I hope that everyone will get involved somehow, whether it's through the nutritional component or through the PE component. It's just a lot of fun for me, and I think that it's a dire necessity.
We all can play a part. Everyone has a role to play because everyone has a stake in the outcome. No matter what you do, you're encouraged to get involved, to make a difference, to work together to shape a healthy future. To find out where you fit in, visit www.ourcommunityourkids.org.